So we are welcome to the class as hopefully. So this is last week we quickly summarized the outcome of this work called Diagnosis of Alzheimer Disease in the Eastern Province of Saudi Arabia using computational intelligence techniques. We happen to have been published in the Computational Intelligence and Neuroscience Journal, ranked as Q1. We did discuss a summary of the work last time. So today, what we want to look into, as usual, is to look at the detailed procedure that has been taken. So that is why we're looking into the full paper itself. As we can see, these are the details. So what really transpired in the entire article, as we discussed in one of our videos on the procedure to present or to discuss your work, because we did mention that in machine learning, report writing is very important, even in corporate world. If you are not, even if you are not a researcher, you need to be able to document what you have done, so that outcome of your machine learning experiment should be known to people. So because the model you have built is actually a combination of well-described hyperparameter values you have used, the environment you have carried out the research. These are very important so that someone else should be able to repeat what you have done. So by way of then also they can try to improve upon what you have done. So, and then in research work, for example, the appropriateness of the title is very important. You have to make sure you select the appropriate title. As you can see here, by just looking at the title, you should be able to have an idea of what this work is all about. So this is Preemptive Diagnosis of Alzheimer Disease in the Eastern Province of Saudi Arabia using computational intelligence techniques. Preemptive diagnosis means we try to do the diagnosis before actually the disease symptom sets in, because it has been established that often than not, before symptoms start appearing in someone's body, usually it gets to late stage. In most cases, late stage of the disease, in which case it's going to become very difficult, if not impossible, to cure. Because several organs of the body must have been affected. However, if you can take prediction to preemptive level, that is, it's a kind of a preemptive strike against disease, so that we don't wait for it to cause damage in the body before we detect it by someone complaining and then go to the clinic, because this is usually the procedure. So people will complain and then they go visit doctor, and doctor will say, oh, we are sorry. After running several tests, they say, oh, it's suffering from so-so disease, and we are sorry to say that it's late stage. You see, why do we need to wait for this kind of thing when we have a technology that can assist us? So this is one of the motivation for this kind of work. So preemptively means this system can be made available to anybody. People just feel they are okay. Anybody can just subject him or herself to the test. Check yourself up. Either you see it online or either on a mobile or whatever options that is made available. So that people can know, even while they thought everything was fine, they might be able to diagnose themselves earlier and then report to the appropriate clinic for further follow-up. This was one of the very high motivation for this kind of work. Then, as usual, as we mentioned in our previous engagement, so abstract is very important. See, abstract, this is the abstract of the work. It's very, very important. So you have to make it, because even if the work, for sure, this work is free, they say this is open access paper, anyone can get it online. But sometimes you publish paper that is not open access. Even at that, the abstract is always free. Abstract for all papers are free. So they will see it, people will read it and then decide if it really worth it for them to continue reading your work. So that is why you need to pay a lot of effort. We have to pay attention to the kind of information that we are providing in the abstract. So we can look at it together. You can see here we try to quickly make a case. You said Alzheimer's disease is a silent disease that causes the brain cell to die progressively. thereby influencing consciousness, behavior planning ability, and language, to name few, and several other side effects. They say it increases exponentially with aging, where it doubles every 5 to 6 years. These are facts from medical reports, and they cause profound challenges and implications to the victim, thereby affecting them. They could affect their swallowing capability, losing their ability to speak, and also for others. And one important statistic, very scary, is that according to the Ministry of Health, the Alzheimer's disease patient will triple by 2060. So worldwide, 14 million expected patients worldwide, which is a very scary kind of prediction. So, and the rapid rise of patients is often caused by the silent progress of the disease, leading to late diagnosis. Why? Because the symptoms is often similar to aging process. You see, when people start suffering from this disease, there are symptoms that are similar to aging process. So people will think that, okay, it's old age, it's okay. Meanwhile, not knowing that it's a disease that could actually be treated, or at least palliative measure offered, if it could be detected at a very early stage before it did a lot of damage to the brain cells. This is just kind of, then in abstract, we did mention, you need to be able to put it very clearly that what you want to do, why is it important? Why? We divided the why into two. You see, why is it's important? Why is it important? And then the why of literature gap identified. You see, it's not just enough to say that this thing is important. We have to be able to justify that, okay, it has not been done in history, or people did it, how did they do it? They did it in a different way. Yeah. And this was actually mentioned here. A lot of effort have been made in the past, but actually they use imaging. You see, they use imaging data sets. However, as we know, imaging data set is not something that is common in all clinics. There are a lot of clinics that don't have the imaging capability. So in villages, so that's why this was proposed the use of clinical data, very simple clinical data that can be gotten from any laboratory. See, the simplest of laboratory of clinics or medical center, we have medical lab that can carry out those basic investigation on people, and then those data set can then be used. So the work also proposed the use of 4 support vector machine algorithms, including support vector machine, k-nearest neighbor, adaptive boosting, and the extreme gradient boosting algorithms. So, and their appropriate justification were provided. And also in abstract, we were expected, we mentioned, you tell us also the justification. Why do you choose this particular algorithm? Why not other algorithms? So, and finally, we provide the summary of the result. Very brief summary. What is the overall outcome of what we have gotten? So realize that support vector machine with 95% accuracy and a precision, recall, and area under the receiver operating characteristic, respectively, are these values, which happens to be the best among them, using 13 features. So once the abstract is done, so we mentioned to ourselves that the next is to go to introduction. We need to prepare our introduction in a very clear way. And introduction and abstracts, they have something in common. The same thing in abstract will have to be repeated in introduction, however, with more details, citations. More citations need to be provided in introduction, because in abstract, you don't provide citation. Even when you mention fact, for example, this kind of fact that it has been predicted by 2060, 14 million patients worldwide are expected to be suffering from this disease. Even at that, we didn't put any citation there. This is a fact. And usually when you mention fact, you need to support with citation. But abstract does not support citation. So that is why those facts can come later in introduction, and then you have to cite where you got it from. So citation is very important in introduction, and this is one of the differentiating factors between introduction and abstract. So you write as much as possible in introduction, making it clear what you want to do, why are you doing it, the why from 2 points of view, why is it important, and also the gap. Yeah, from literature, no one has done it before. If they've done it, why do you still think you need to do it? See? So this needs to be made very, very clear. And also you tell us how you want to solve the problem. And then the why of how. Why? Why the method you have proposed? Give us the justification. And finally, you summarize your result. So similar thing presented in abstract will have to be in introduction, but now in a very more elaborate and lengthy form with more citation. And we used to say that the more the citation, the better. Yeah, it's never too much. So cite as much as possible. Actually, for researchers, it actually increased the reputation of your work, because once reviewers get to see the paper, to see that, oh, a lot of work has been cited, that means you've read about the work, you are aware of what has been done in literature, and it increases the confidence they have in your work. Unlike just writing a very, very brief introduction, no reference to previous work. I mean, there's no sign that, yeah, you have really gone to, you have actually done the right thing by going into the literature, reading deeply about what you want to do, so that you can be able to establish if there is genuine need for what you are doing. Because we don't just do research or a project, you have to justify that there's need for it. So this you'll be able to do in the introduction as much as possible, cite who, and a lot of other issues. So for further details on how to write introduction, I refer us to our earlier videos where we describe how to write introduction and abstract. There's a whole video dedicated to that in one of our weekly discussions. Now, the next thing is presented here in the paper is the review of related literature. You see, this is very, very important, especially this is a journal paper. So the literature survey is separated from the introduction. So we mentioned before, if you are writing a conference paper, you might combine literature survey with introduction. It means why you are talking about the why from the point of view of gap identification, you use the opportunity to present the literature survey in summary. That is, if you want to include, you want to combine the literature survey with introduction. Because like conference paper is like maybe just 6 pages, so there's no space. So you want to minimize as much information as possible. You can just put the summary under when you are answering the question, why, from literature point of view, why the need for this work? Is there a gap established from literature, which we have mentioned for this work? One of the gaps is that earlier work has always used imaging, and the unique one is there is no one that has ever used Saudi Arabia data set on this particular disease, which is very important because in machine learning experiments, using the data set from another area can tell you a totally different thing when you use data set from another demography. So now, so the literature review in this case has been done elaborately. So we go into, say, several work that has been done. We try to explain it out, summarize where appropriate, then identify some of the weaknesses of the earlier work, and then see how the work can fit in. So to support the literature review, you can see here a summary table has been provided. It's not compulsory, but it's always good. It could improve your presentation of your work. You see here, you can see here, these are summary, authors, the techniques used, and then results achieved by each of the papers, and then the gap. You can see here limitations. You see, the data set utilized are imbalanced, the model sensitivity is considered low. So once you identify some of these, this could actually be a basis for other people to continue to work in this area. You can just look at those work, pick up their data set, and try to improve upon what they have done. You can see here. So maybe if they use different data set from the one the previous researcher did. So you have a host of limitations. Usually reviewers like to have this kind of summary because sometimes, yeah, It's good to read through the entire thing, or as you read, but people like to have a kind of table summarizing what you have seen in the literature. Though not compulsory, but it's a way of improving the presentation of your work, because presentation also matters when you are trying to present the outcome of your research. Now, so this is still part of the literature survey, and then the summary is already shown. Once we are done with the literature survey, of course, the next thing is to move to the materials and method, or what we call the empirical studies. The empirical studies, so you have to make it very clear the environment where you carry out this experiment. This is made clear. Python programming language was utilized in this experiment, clearly stated, because someone might want to reproduce, things have to be made clear. Unlike the previous paper we presented, the COVID-19 anxiety paper, it was all done in weaker environment. So like I said, machine learning gives you that particular freedom to try any environment you want. You want MATLAB, you want Python, you want R. There are so many languages and platforms. No one is restricting you. No research journal or conference will restrict you to any platform for your machine learning application work. This is the unique thing about it, and an advantage that people can take to make sure that they benefit themselves as quick as possible. If you don't know programming, you don't need to first of all say, oh, don't be discouraged, I don't know how to do programming in Python. No, you can use Weka that doesn't need programming to solve the same problem. And we have done it before in our previous paper. You can check it out. COVID-19 anxiety prediction was totally done in Weka environment. So for this one, it's done in Python environment. So other ones also, another paper we're going to present maybe after this also has been done using Weka by an engineer, by the way. So what we are saying is, in essence, the freedom is there for us to explore as much as we want. So under AI material and method, or what we call the empirical studies, we have to describe what with algorithm you have used, the kind of implementation environment, so that people can be able to pick it up and reproduce it. So you mentioned the step you have taken. We have used support vector machine, gradient boosting, adaptive boosting, and k-nearest neighbor. You also let us know that you have used grid search, you have used feature selection, sequential forward feature selection. So you have to mention whatever thing you have done, like I summarized this way, whatever thing you have done that someone will not know. If you don't state it clearly in the paper, it becomes compulsory for you to state it there. See, this is very important under the experimental description. You don't tell us details about how to install Python, how to use Python. This is not the business for this paper. Anyone want to use Python can just Google and search how to do that. But however, anything you know that if you don't state it here, there's no way anyone will know it, because you are the one that did the experiment. So if you decide to hide anything, there's no way we can know your mind. That thing becomes compulsory that you need to put it in your paper. This is how you differentiate between what do I need to mention and what do I need not to mention. Because we used to have in the past, maybe people, the beginners, they put as much information that are not necessary under their method and experiment or empirical studies, telling us how to download Weka, where to download it from, and how to install it. This is not part of reports of experiment. Anybody can easily find out how to do that. But how do you optimize your parameter? Did you use feature selection? How did you divide your data set? Is it 30%, 60% for testing or training, as the case may be? These are the important information known by you only, or you and your team. It becomes compulsory to include those important information. Now, so the next thing is data set collection and cleaning. Data set collection can be combined together. But like I mentioned last week, this experiment had a special case that the data set came in a very rough, a very deep pattern that we have to do a lot of extraction by ourselves. It's not ready-made in Excel. You see, sometimes you get very ready-made data from the clinic or from your job or from your company. That's very interesting. Just bring it, put in Excel, you are ready to go. But sometimes the data come in a very complicated way, then you might have to do data extraction, as we have to do in this case. So We said the data set was obtained from King Fahd Specialist Hospital in Dammam. So consisted of 11 features initially, but in reality, there are repetition of different tests, different visitation at different times that are contained. So this data need to be sorted out appropriately and extracted. Now, before we continue with the data set, here is the framework for the study, which is a summarized procedure. So we mentioned this last week. We discussed in our first video on this, so we can check it out. So we say this is data collection. Yeah, we have the raw data. We have to develop a parallel filtering algorithm to help us extract the data, because it was taking too much time to do that. But these are all optional. They are not part of the machine learning procedure, by the way. This is just trying to prepare our data. You can say the other data preparation or data collection. If you are very fortunate or lucky, you could get a data that's very clean. You don't need all this procedure. You see, just pick up your data, put it in your machine learning algorithm platform, and you are ready to go. But in this case, we have to do outlier remover, missing value imputation, normalization, and then, as the case may be, we come back to this one again. So these are procedures. Then we have the optimal parameter search. Then we have model building and then model testing, and then discussion of result will follow. Now, see on the data set, so we try to check out, okay, to do this is more of, I don't want us to bother more about this procedure. This is parallel programming concept need to be introduced here. We don't need it at this level. So it became necessary because of the nature of the data set. It was huge, and using ordinary programming will not work. We have to do parallel programming at a point in time. So which will describe a little bit here, how to do that and to speed up. And we're able to get a lot of time benefits by doing that. But we won't bother with that for now. So on the data set description, after applying the filter codes and removing the duplicate records, data set contains standard clinical tests for 152 patients, where 63 were positively diagnosed and 87 were negatively diagnosed with AD. So, however, with this number of samples, this is the number of patients identified finally, out of several thousands, we found that 152 are the ones that are usable. So, because when you see some features are having so much missing value, that's a yardstick, that's a particular threshold. If the missing value is more than 30% or 40% or 25%, we can delete that column from our set of features, because the number of missing value you are going to fit in is going to be too much, which might make your data to become more like artificial data, not original. So if there's any column that is having so much missing value, it is recommended that you can remove those columns, especially if you still have other columns that are acceptably more. So there are 435 clinical features. So however, only 18 attributes were utilized to build the AD prediction model. You see, out of 435 clinical features, 435. But due to the presence of so many missing values, we had to finally select 18 attributes out of this 435. You see, this is not feature selection stage yet. This is just data preparation. We look at the missing values. If there's so much missing value in a particular column, we delete that column. You see, this is one of what things we do under preparation of data or pre-processing stage. So finally, we settle for the 18 attributes, 152 patients, divided among into 63 positive cases, 89 negative cases. Now, and then it is mentioned here that we remove column that has missing value that exceeded 30%. So it depends on analyzing your data. We found out, okay, if we remove columns with 30% missing value, we are going to end up having 18 attributes. 18 attributes for medical prediction is still very much high. So which is okay. So we can deal with 18. But if you find out that after removing 30%, you are going to have only one attribute, then you have to reduce the percentage of the remover. And if the number is going to be still very huge, then you can increase the percentage. So it depends on the kind of data set we have, and then you can take the decision appropriately. Of course, it's always good to talk to experts in this area who can provide the necessary guide. But I hope that in some of your new areas, you won't have to pass through these very detailed procedures. So as in reality, you might not really need, you might not have these huge features in your own area. But if you have it, these are the ways you can deal with it. Now, the next one is, okay, this is the data filter parallel code. This is the pseudo code for parallel algorithm developed to extract the data. Like you said, it's not part of the machine learning system. So we are not going to bother ourselves about that. But people might be interested in parallelization later. Then you can look at it and then you can ask questions later, or you can engage us on that. So we always want to avoid what is not really compulsory. We don't want to avoid it, avoid making it to distract you from the real issue. So this is the data filter process, pseudocode, the algorithm developed to do that. So if your data set is very clean from the onset, you don't need all this trouble. You just go straight to your modeling. Next is statistical analysis. So it's always good to carry out statistical analysis. See? So this is going to give you an idea, it provides essential tools for visualizing and understanding the data patterns for better pre-processing and modeling. When you see the statistical analysis, you'll be able to know the number of missing values, you know the minimum and the maximum number, you know the minimum and the maximum number that is available in your data set, you know the range of value, then you can be able to see if there's need for normalization. We explained earlier, if the range of values are very wide, one is 0. The minimum value for a particular variable is 0.2, and the other value is like 1,000 or 100, you can start to think that, oh, it means the range is high. Can I bring this data together by normalizing them to be between zeros and 1? And we actually did it for this experiment. As we move on, you're going to see it. So based on the statistical analysis, we're able to identify some of the attributes as the case may be. So these are the 18 attributes identified. Finally, you can see these are simple attributes: the sex, the age, the body temperature, white blood cell, and also further simple laboratory work that can be done by any medical center. So this is the statistical analysis of the data. You can see the mean, the standard deviation, the minimum and the maximum, very important, minimum and maximum. If they're so far away, then it means we might need to do normalization. See, here is 0.7, here is 16 maximum. They are not sitting on the same, they are not close together on the number line. You see, here is 1. So once you see that there's a little bit of gap, and also this is temperature, this is respiratory rate, BP diastolic, white blood cell count. See, they are properties or attributes that are not related in most cases. So the unit of measurement are different. Usually when you have unit of measurement, it is good to do normalization. And this is one of the reasons why we normalize the data. We have finally converted the entire data to be between zeros and 1, so that either you are using kg or you are using gram, another one you're using another unit of measurement, is not going to affect your data. This is the advantage of normalization. Now, so based on the statistical analysis, we had to do outlier remover. We noticed a lot of outlier numbers that are totally out of range. Using box plot, we can know this and how to check them. So we did outlier remover, missing value treatment. We mentioned that one also. So we try to input the missing value using k nearest neighbor. There are different ways of treating missing value, because if you want to remove all the attributes that has missing value, we're going to remove maybe all the attributes. So it's not possible. So we have to remove as much as possible while keeping the minimum that we need to do our work. So, and then to fix the missing value, there are several methods of doing that. In this case, we use k-nearest neighbor, which is a machine learning algorithm. We use it to fit the missing value. For missing value treatment, you can refer to some of our earlier videos where we discuss pre-processing and how to treat missing values. Now, so this was classically done. And then, so we put the missing value using the appropriate equation, Euclidean distance, and all stuff for that. We don't want to go into that one. Then the data scaling, which is the normalization, we use the min-max scaling approach. So we converted the data to be in the range of 0 to 1. So irrespective of the value of the input, we convert it to be between 0 and 1, so that hopefully it makes the modeling easier. Now, so that is under the data description, and then host of others. The next is a description of the utilized machine learning techniques. The next stage in your procedure is the procedure for writing such a report is to describe each of the techniques you want to use. See, we started with support vector machine. You don't need to write 25, 15 pages, just a little short description of it, how it works, especially if you can provide a couple of equations to back up the background of the way it's really functions. It will be very interesting, and it's encouraged actually. So if you can provide few diagram about support vector machine, that will be interesting on how it works, especially how it converts data in a unique way from lower dimension to higher dimension, that if the data is not separable at the lower dimension, it can become separable at higher dimension. So we also describe the adaptive boosting. So these are established algorithms, so you don't need to reinvent the wheel. Just present it in a summarized form, so anyone will have an idea of how you are going to do and how is it going to relate to the data you're modeling. So each of the methods need to be described one after the other appropriately. So that is on that. The next thing we mentioned is the synthetic minority oversampling. Yeah, the issue of oversampling. I mentioned to you before that we had 63 positive and 89 negative cases. So this is called imbalanced data, and considering that the data itself is not much, so we have to carry out what we call, because when you have such a thing, we do balancing. You need to balance the data. So how do we balance the data? What are the methods that are available for us to balance data set when we do machine learning research? See, so we have, if you can do undersampling and you can do oversampling. Undersampling means you reduce the data set with data sample with a higher number, you reduce it out to 63. You see, or you can also increase the smaller one to meet up with the higher one, depending on the number of the size of your data. If the data is huge, you have a big data, maybe one is like 450, the other one is like 1,000. You can reduce the 1,000 to 450, you now have 450 here, 450 here. However, when the data set is not very big, then you might need to consider what you call synthetic minority oversampling. You try to increase the number of minority class to meet up with the majority. This has been done, a lot of studies have been carried out, and it is valid if you have to do it in the experiment. So in this case, there's a particular algorithm called SMOTH, which is called the synthetic minority oversampling techniques, that has been employed to try to see, okay, can we balance the data so that the number of samples for class A and class B, that is the Alzheimer's disease positive case and the Alzheimer's disease negative case, they can be the same. This is very important to avoid a situation whereby we are going to have the effect of imbalanced data. For effect of imbalanced data, we've explained it before. You see, if you have imbalanced data, it can make the system to predict in favor of one. Of course, the majority class will have a kind of favored prediction because it's in the majority. So during training, the system gets to be exposed more to that data. So there's possibility of getting it correctly compared to the lower one that are fewer in number, that the system doesn't have the opportunity of seeing many of them. And regarding, unfortunately, the system here have the negative case is the one that is more here. So if we allow it to be like that, for the negative case to be majority, as we have it in the data set, that can make us to have a lot of false negative. You see? So in this case, we decided to say, okay, we're gonna use oversampling so that we can push the number of the minority to be equal to the majority. And then this was implemented appropriately, and then experiments were carried out. Now, so once this was done, then we were able to get some experimental result out at the initial stage. Then, how finally does this affect the final Alzheimer disease prediction model, which we call establishment of Alzheimer disease prediction model, the final model? How did we then produce it? How then do we actually generate it? And what was the effect of the oversampling or undersampling method that we have carried out on the outcome of the work? I believe, so we are going to answer some of these questions, inshallah, in our next sitting. So we're going to call it a day here so that we can give room for people to ask any question that is not clear based on the portion we have covered so far. So hopefully by next week, we'll be discussing the remaining part of the work, and hopefully maybe the concluding part as well. So thank you all for listening. And then now we can take questions. So if you have questions, you can raise up your hand for recognition, and then we can discuss further. Thank you very much. So